As women age, their bodies undergo numerous hormonal and physical changes that affect every aspect of their health, including intimate hygiene and odor. One of the most sensitive yet commonly misunderstood issues among senior women is the development of an unusual or unpleasant smell in the vaginal or genital area. While many older women may not even notice it themselves, this smell can sometimes be evident to others and cause feelings of embarrassment, shame, or confusion. What makes this issue more complex is that in most cases it is not caused by poor hygiene or lack of care, but by a combination of age-related changes and lifestyle habits, particularly clothing choices. Doctors and gynecologists who specialize in senior women's health have long observed that certain clothing habits can drastically increase the risk of odor discomfort and even infections in older women. The purpose of this article is to shed light on why this happens, what specific clothing habits are to blame, and how older women can take simple, effective steps to feel fresh, clean, and confident. First, we must understand what physiological changes occur in the body as women age and how they affect the intimate areas. With menopause, estrogen levels significantly drop, which causes the vaginal walls to become thinner, drier, and less elastic. This leads to a condition known as vaginal atrophy, which not only causes discomfort during intercourse but also makes the area more prone to bacterial imbalances and infections. A healthy vagina has a delicate pH balance and is naturally acidic, but with the loss of estrogen, this balance is disturbed. The result is a shift in bacterial flora, making it easier for odor-causing bacteria to thrive. On top of these biological changes, older women often suffer from other health issues such as diabetes, urinary incontinence, or reduced mobility, all of which can contribute to increased moisture retention and bacterial growth in the intimate areas. But even with all these challenges, there are preventative measures women can take. Surprisingly, the most effective of these involve changes in everyday clothing habits. Here are 7 key clothing habits that doctors warn senior women about, which may be unknowingly causing or worsening intimate odors. The first habit is wearing synthetic underwear. Many women prefer synthetic fabrics like nylon, polyester, or spandex because they look sleek, feel smooth, and are often marketed as seamless or comfortable. However, these materials do not allow the skin to breathe and tend to trap moisture and heat. In the genital region, this creates a warm and damp environment that is ideal for bacterial and fungal growth. Cotton, on the other hand, is breathable, absorbent, and helps to keep the area dry and cool. Doctors highly recommend switching to 100% cotton underwear, especially for women over 60. Not only does it reduce odor, but it also lowers the risk of yeast infections, urinary tract infections, and skin irritation. The second clothing habit is wearing tight pants or leggings. Although tight-fitting pants may be fashionable, they can be harmful to senior women's health. As the body ages, blood circulation tends to slow down, and tight clothing only exacerbates this issue. Tight pants compress the genital area and inner thighs, creating friction and heat, while also restricting airflow. This can lead to chafing, increased sweat buildup, and bacterial overgrowth. Moreover, tight clothing makes it difficult for the vaginal area to stay dry, which can result in a musty or sour smell. Doctors recommend opting for loose, breathable pants made of natural fibers such as linen or cotton, especially in warmer climates or during physical activity. The third harmful clothing habit is wearing the same undergarments for too long. Some older women may not change their underwear daily, especially if they live alone or have reduced mobility. Wearing the same underwear for extended periods of time allows sweat, urine discharge, and bacteria to accumulate. Over time, this buildup creates an unpleasant odor and can irritate the skin. It is essential for senior women to change their underwear at least once a day, and ideally more often if they experience incontinence or excessive sweating. Doctors also advise keeping extra pairs of clean underwear handy and using gentle hypoallergenic laundry detergents to avoid skin irritation. The fourth habit that contributes to odor is wearing panty liners or adult diapers without changing them frequently. Many older women suffer from light urinary leakage and choose to wear panty liners or incontinence pads. While this is a practical solution, it can backfire if the pads are not changed regularly. The trapped moisture from urine, even if minimal, becomes a breeding ground for odor-causing bacteria. In addition, some commercial pads contain perfumes and chemicals that can irritate the skin and disrupt the natural pH of the intimate area. To avoid these issues, women should choose unscented, breathable pads designed specifically for sensitive skin and change them every few hours, even if they don't feel soaked. The fifth problematic habit is wearing underwear to bed. During the day, it's necessary to wear underwear for support and protection, but at night, letting the intimate area breathe is beneficial. Sleeping without underwear allows air circulation, which helps keep the area dry and balanced. If going commando at night feels uncomfortable, then choosing a loose pair of cotton shorts or pajama bottoms is a good alternative. Doctors have observed that women who go without underwear at night tend to report fewer complaints about odor and irritation compared to those who wear tight or synthetic undergarments while sleeping. The sixth clothing mistake is wearing shapewear for long durations. Shapewear is popular among women of all ages for its slimming effect, but it can be particularly risky for older women. Tight elastic shapewear compresses the pelvic area, restricts airflow, and retains moisture, all of which promote the growth of odor-causing bacteria and fungi. Additionally, shapewear can press on the bladder, making incontinence worse or more likely. Senior women should limit their use of shapewear to short periods and avoid wearing it daily. If body confidence is a concern, it's better to invest in high-quality breathable shapewear that is specifically designed for mature women. The seventh and final harmful clothing habit is wearing wet or damp clothing for extended periods. After swimming, exercising, or even sweating during a hot day, some women may not change out of their wet clothes immediately. Staying in damp underwear, swimwear, or pants allows bacteria and yeast to multiply rapidly, causing odor, itching, and infections. Doctors strongly advise senior women to change into dry clothing as soon as possible and to avoid sitting in damp garments for longer than necessary. Keeping a spare set of clothes in a bag or car can be very helpful for women who are often on the go. In addition to these 7 clothing habits, there are other lifestyle and hygiene practices that can greatly influence intimate health in senior women. For example, using harsh soaps, douching, or applying scented sprays can disrupt the natural pH balance and lead to odor. It is better to clean the vaginal area with plain warm water or a gentle pH balance cleanser made for intimate hygiene. Staying hydrated, eating a balanced diet, and maintaining regular physical activity also play a vital role in keeping the body's systems, including the reproductive system, functioning properly. It's also important to have regular checkups with a gynecologist who can monitor for infections, hormonal imbalances, or other health issues. Many times, women ignore changes in smell because they assume it's a normal part of aging, but persistent or strong odors should never be dismissed, especially if accompanied by discharge, itching, or discomfort. Early detection of issues such as bacterial vaginosis, yeast infections, or urinary tract infections can make a big difference in outcomes and quality of life. Ultimately, intimate odor in older women is not something to be ashamed of, nor is it a reflection of poor hygiene. It is often a result of natural aging combined with modern clothing habits that are not suited for mature bodies. By being aware of these 7 clothing mistakes and making simple yet consistent changes, women can significantly reduce unwanted odors, improve their comfort, and boost their confidence. The goal is to create an environment where the intimate area can stay dry, clean, and in balance. This doesn't require expensive products or drastic changes, just thoughtful choices in fabric, fit, hygiene, and self-care. One of the most misunderstood facts about vaginal odor is that it is not always a hygiene issue. In older women especially, the causes are far more complex and tied into the natural decline of hormone production, changes in skin elasticity, reduced sweat gland activity, and even slower cell turnover in the vaginal region. When combined with the wrong clothing choices, these physical changes create an ideal storm where odor becomes not only more likely but more persistent. Doctors emphasize that fabric type, fit, and frequency of change in undergarments play a massive role in either supporting or sabotaging vaginal health. Beyond just material breathability, another key factor is moisture management. Moisture from sweat, urine, or discharge trapped in synthetic fabrics increases the risk of anaerobic bacterial growth, the kind of bacteria that thrive in low oxygen environments and often produce a foul odor. These bacteria are not only smelly but can also lead to inflammation, redness, and chronic infections. This is why cotton and other breathable materials are recommended for all-day wear, while synthetic fabrics should be reserved for short durations if used at all. An often overlooked aspect of this issue is the fit of clothing around the waist and hips. As women age, skin becomes more sensitive and prone to breakdown. Tight elastic bands from underwear or shapewear can cut into the skin, restrict circulation, and cause microabrasions. These small skin injuries can serve as entry points for harmful bacteria or fungi, which again leads to odor and sometimes infections. Moreover, elastic materials that are too tight also tend to trap heat, further escalating the risk. Another problem faced by older women is decreased mobility. This can affect how often they are able to change their clothes, how frequently they bathe, or even how effectively they clean their intimate areas. Women who struggle with arthritis or other mobility issues may find it physically painful to bend, twist, or reach certain areas. In such cases, simplifying wardrobe choices becomes crucial. Loose-fitting clothing with easy closures and elastic waists can help improve daily hygiene routines and reduce friction-related issues. Incontinence is another widespread issue that intersects closely with clothing habits. Many older women leak small amounts of urine during coughing, laughing, or physical exertion and rely on pads or adult diapers. While these products are essential, they can become a hidden source of odor if not handled correctly. Extended use of wet pads, even if they feel dry to the touch, leads to odor-causing chemical reactions when urine interacts with the materials in the pad or with vaginal discharge. The solution is not just frequent changing but also using products that are specifically designed for odor neutralization and skin protection. Medical professionals recommend avoiding generic scented pads and instead choosing hypoallergenic versions that contain charcoal layers or pH neutralizing technology. Another concern is the use of anti-chafing products or powders. Many older women apply talcum powder or scented sprays to reduce sweating or friction, but these products often do more harm than good. Powders can cake up in the folds of the skin, trap moisture, and eventually turn into breeding grounds for fungi. Scented sprays or deodorants contain alcohol and other harsh ingredients that disrupt the delicate pH balance and remove the protective barrier of the skin. The best approach is to wear proper breathable clothing and limit the use of external products unless prescribed by a healthcare professional. Postmenopausal women often also experience a drop in natural lubrication, which causes dryness and irritation. This dryness makes the vaginal lining more susceptible to microscopic tears, which can result in infection and inflammation, both of which may produce an unpleasant odor. Using estrogen creams or vaginal moisturizers under medical supervision can help maintain a healthy environment. But again, the support from breathable and well-fitted clothing can significantly enhance the comfort and effectiveness of any treatment. The importance of nightwear should not be underestimated either. Sleeping in tight synthetic clothing traps sweat and bacteria for up to 8 hours every night. Switching to loose breathable nightgowns or pajamas made of cotton or bamboo fabrics allows the skin to regenerate and prevents the conditions that lead to morning odor. Even something as simple as airing out the intimate region during sleep can lead to long-term improvements in odor control and comfort. Women who experience frequent odor despite following basic hygiene may benefit from consulting their doctor for tests such as a vaginal culture pH test or urine analysis. These tests can identify hidden infections that are not obvious but still contribute to chronic smell. Sometimes a persistent odor is a sign of systemic issues such as diabetes, kidney problems, or dietary imbalances. This is why a holistic approach that combines clothing changes with medical awareness and lifestyle adjustments is essential. Beyond the clinical aspects, this is also a psychological issue. Many older women feel embarrassed to discuss their intimate concerns even with close friends or doctors. This silence contributes to ignorance and allows the problem to persist. In reality, intimate odor is extremely common among women above 60, and it should not carry shame or stigma. Open communication, education, and proper guidance can make a huge difference in the way women handle this sensitive issue. Family members, especially caregivers, should be educated to support senior women in choosing the right kind of clothing and personal care products. For example, a daughter or caregiver helping an elderly woman shop for undergarments should prioritize comfort, moisture control, and ease of use over style or brand names. Clothes should be easy to put on and take off, especially for women who need assistance. This level of consideration not only helps with physical hygiene but also restores dignity and emotional well-being. It is also important to consider the effects of seasonal changes. During summer months, when sweating increases, odor can become more noticeable and persistent. During winter, the problem often shifts to dryness and skin irritation due to heating systems and woolen garments. Wearing layers of breathable fabrics and adjusting undergarments to suit the season can play a significant role in maintaining a fresh feeling throughout the year. Even laundry habits have a role to play. Many women use strong detergents and fabric softeners that leave residues and artificial fragrances which can irritate the intimate area. Over time, these residues build up in undergarments and contribute to odor rather than eliminating it. Washing underwear separately with a mild fragrance-free detergent and rinsing thoroughly can help prevent such issues. Air drying rather than machine drying also preserves the fabric's integrity and reduces the risk of bacterial retention. In conclusion, older women can take control of their intimate health by making mindful choices in their clothing habits. These 7 clothing-related practices: avoiding synthetic underwear, choosing breathable fabrics, avoiding tight pants, changing underwear daily, minimizing use of liners or diapers at night, going underwear-free during sleep, limiting shapewear use, and avoiding damp clothes, are not only doctor-approved but can bring profound changes to how a woman feels and smells. The key is consistency, awareness, and willingness to adapt to the needs of a changing body. With small adjustments and better education, this issue can be prevented rather than merely treated. In a world that often overlooks the personal hygiene struggles of older women, especially intimate ones, it is crucial to spread awareness, remove the stigma, and encourage open, honest conversations. Every woman deserves to feel fresh, clean, and confident no matter her age. These simple changes can lead to a dignified, healthier, and more comfortable life in the golden years.